too much. I'll rush through this little bit here, pre-stuff, and then we'll get onto that agenda. Just a bit of background. I know I spoke to a few of you sort of prior to Christmas around a couple of reasons why there was a delay in some of our big projects of work and some of the really important bits of work we wanted to get off the ground, like Community Voices, and we'll go into that in a little bit detail later down the agenda. But and a lot of that was because of our latest restructure in the organisation and in our communications, marketing, and engagement directorate in particular. Really pleased to say we've got through that now. So I think that's the second one, I believe, in the last 2.5 years. There's obviously been a lot of uncertainty for people, as you can imagine. I know many of you have worked in the NHS before. We've obviously, there's been people competing for jobs. We've lost some really good people. But now the positive is I think we can really look ahead in 2025. Hopefully no more restructures for us. We can just crack on, build some momentum, and really start to move forward in the coming months with a lot of the ideas that we've had and you've had and co-produced with us. And in terms of this forum, it's really good news as well, because that means we can absolutely continue this forum and start to really see it grow, I think, in the coming months and into the end of 25 and 26 and beyond. So a bit about my job title has changed as a result of the restructure. So I was head of community engagement and insight. I think it's now social marketing and insight. What that really means, got a fabulous team. I've got an absolutely brilliant team. What that really means is that every campaign, every social marketing or communications campaign we put out there in the public, whether that is we talk about 111 in a minute, promoting 111, or pharmacies, or cancer awareness, mental health awareness and prevention, whatever that might be, every campaign is fueled by data and insight before we go anywhere. So every decision we make on a campaign, who we're talking to, what we're saying to them, and how are we engaging with them, how do they want to be engaged with, we do that. We follow the data and we follow the insight, and that should give us more meaningful campaigns that really make a difference in our community. So we started that at the start of January, so it's only been 5 or 6 weeks. We've had a really, really good start, and Bridget will talk a little bit about our first campaign as a team, 111, a little bit later. But just wanted to give you a little bit of background to that. Hopefully we're through the final one of our restructures. Please, that'd be brilliant. And then, as I say, we can really progress and move forward from there. Next slide, please, Bridget. Just a little bit of housekeeping before I go into the agenda then. So if we can keep microphones on mute, that'd be brilliant. Please use the chat box or raise a hand in the control panel to ask questions. There'll be an opportunity to ask some questions after each of the presentations. As always, and you always are, which is great, please be a good listener if you wish, and an active participant if you want to. And obviously you can see that we've started to record for people who can't necessarily make the meeting now. So by participating in this session, you're agreeing to it being recorded, if that's okay. Can everyone hear that?
Yeah, you can see there's several people still not muted under their names. They just want to double check it.
Thank you. Is it all right if everyone can just mute their microphones, please? That'd be brilliant. That a bit better. Are we getting there? Are you able to mute people, Bridget? There we go. Amazing. I think we're there. Right, so agenda. So yeah, I've pretty much done the welcome. So we will go into, I'll say a few words about our NHS, the next chapter, We Need to Talk, a big engagement exercise we did prior to Christmas, a month's engagement exercise that I'll go into in a bit. Some good news around Community Voices and the development of that. 2 seconds. Thank you. So Community Voices, good news around that. NHS 111 campaign. Bridget will come in and talk about that, a really exciting campaign that we launched a few weeks ago, and asking for your input in helping us with that as well. And then Bridget put a survey out back in December, feedback from you guys around the meeting so far and where you want to take it moving forward, so we can relay some of that. And then we talk a little bit more about the next patient engagement network as well, which will be in May. Thanks, Bridget. So we need to talk. I think we've done bits on this before. This was a massive engagement exercise between the middle of October and the middle of November. And it was following on from the Darzi report, and gave us a real opportunity really to look at, I think most of us in this arena, certainly working in the NHS, and most members of the public would appreciate, for the NHS to be sustainable and as good as it possibly can be for our population moving forward, then we probably need to make some changes. But before we do anything like that or make any decisions on that, we obviously, as you'll all know, need to take the patient experience, speak to people about their thoughts, experiences and insight into the services they're using in the NHS. So huge piece of engagement work went on between, as I say, mid-October and mid-November. And over those 4 weeks, just a bit of an overview in terms of statistics, 3,427 survey responses. You'd expect me to say this, but that is over 4 weeks a really, really good response rate. I think the target was 2,500. So we were really pleased with that number. The most important thing is having quality conversations with people, but my belief is that the more quality conversations you have with people, the better. So you want a good quantity and very good quality as well, and we've certainly got that, which is great. That included 54 engagement events broken down into focus groups, so going into seldom heard communities, whether it was mosques or Gurdwaras, all sorts of different groups, and speaking to groups of people about their thoughts, getting them to fill in the survey, but also areas of high footfall as well, so kind of outreach clinics in shopping centres such as North Point Shopping Centre in Brantzone, where Bridget and I were last week talking about 111, but areas where you've got lots of people walking through and you've got an opportunity to speak to more people and from diverse backgrounds, which is really key as well. And overall, I've got no idea how the team have worked this out, but it's really, really good. Through the technology we've had 1,123 face-to-face conversations on top of the survey responses, which is fantastic. Underpinning all of this was a real strong social media presence with the link through to the survey, and we had 1.6 million people see all the posts together. So that was a good effort from the social media team as well. Just a breakdown on who we heard from. Critically, 78% of respondents are members of the public, which is great. We obviously wanted that to be the majority of people, which it was. Nearly 21% were staff and just over 1% were system partners. So we would want to do a little bit more on that in our next piece of engagement and try and improve that if we can. And there are just some statistics around the online news articles generating more than 491,000 impressions. Nearly 6,000 people visiting our dedicated webpage on Let's Get Better, which is more and more becoming our public-facing website moving forward. Social media posts generated more than 3.7 million impressions, if I can get my words out. And of the staff that responded, 20 across the system, 20% were from the ICB. So pretty good figures there. Michelle and the team's done a really good infographic here, just summarising the headlines before I go into a bit more detail. Crucially, we know elements of the NHS have got to change, and 97% of people agree the NHS needs to change in some form, which probably wasn't a massive surprise, but obviously a huge number. I can't do the maths out, 3,427 responses, but that's almost 3,427. 70% think some services should be stopped or delivered differently, and we'll go into a bit more detail on that in a minute. This is something we hear quite a bit of, if I'm honest, so this wasn't a huge surprise, but without further investment in the NHS, people want us to really prioritise primary care, emergency care and mental health care. Just And if you sort of three more key headlines really out of this, the most important ones are hospital to community. As you can see there, the vast majority of people want easy access to general health services in a coordinated way as close to home as possible, or digitally. So we are seeing people now maybe embrace digital a little bit more than what they were a few years ago. Still some reservations in some communities, but certainly embracing it a little bit more than what's happened before. Over half of respondents expect to have access to urgent care within a short journey, and people want to see a better use of community assets and resources, including the voluntary care sector. Analog to digital, as I've just mentioned there, this was quite a big statistic to come out of it. People are 5 times more likely to always use digital methods for online banking than for health, but the vast majority are willing to use it. So a real opportunity for us there to start improving, I think, digital services and communicating and marketing them a little bit better. People currently find some digital health services difficult to use or inconsistent. And for me, in the conversations I had in the community, there's a real consistency around the NHS app as one example. So at some practices in Humber and North Yorkshire, you can book a GP appointment. At many others, you can't. At some, you can cancel a GP appointment. At others, you can't. So it's just working on that consistency across the patch, which is ongoing at the moment. And it makes our lives easier in comms and marketing if it's consistent across the patch. If you're trying to sell a particular service, it's helpful if what's happening in North Yorks is also happening in North Lincolnshire, for example. So, and then just the third and final one there, sickness to prevention. When asked about what else the NHS should consider, 16% of people unprompted told us that prevention needs to be an area of focus for the future of the NHS. People are really starting again, I can only sort of relate to the conversations I had with people direct. More and more people are than I've ever heard talking about or understanding that maybe people need to take more responsibility in certain areas for their health earlier in their lives to reduce pressures on the NHS. But actually we have a big role in that as well in terms of educating people. Prevention obviously being key, as I say. But what are those tips? For example, I spoke to children and young people in York. You'll see a video in a little bit of some of those that we spoke to. They all said that happiness was really, really important to them, but not one of them said that that they did any exercise. Well, I think most of us will know and understand that to get to a happier place, sometimes exercise can, not always, but can really help with that. So maybe going for a walk every day rather than being stuck on your phone for hours on end, getting some vitamin D, although there's not been a lot recently, hopefully in the next few months, doing some weights, going for a run, whatever it might be, doing something can help. So there's potentially a marketing campaign, communications campaign there for our children and young people as an example. Next slide, please, Bridget. I'm just going to close a couple of these up here for a second so I can see them. I just wanted to bring it back to just quickly just a reminder, and I know a lot of you have seen this before, our overarching system and organisational strategic objectives moving forward. So narrowing the gap in healthy life expectancy by 2030, increasing healthy life expectancy by 5 years by 2035. How we're going to get there in terms of the 4 big health outcome priorities, we're really going to work hard on cancer, reducing harm from cancer, cutting cardiovascular disease, living with frailty, and as I've just mentioned there, enabling mental health and resilience, especially where there's a massive issue with young people. And underpinning all of that to get there, voices at the heart, as you'll see at the bottom there. Personally, I'd rather see voice at the heart at the top, doing the job that I do, but it is where it is. But underpinning it all, still really, really important. We can't do any of that stuff above without listening to people in our different and diverse communities. Thanks, Bridget. So some of the key issues that have come out then, emergency and primary care remain the absolute backbone of healthcare priorities for the population. More than 70% of respondents who identified as LGBT+ or living with a mental health condition prioritise mental health care above all other services. And more than half of respondents aged 0 to 24 years and those with a learning disability prioritise mental health services as their second biggest priority. Interestingly, end of life care is the least prioritised service overall. Access, obviously, as you can imagine, came up time and time again. Often people told me that access was very, very difficult, but when they did get access, the care they got was very good. It was getting there that was the issue. Difficulties in contacting services, particularly GPs, long waiting times, including being on the phone, and appointments offered at inappropriate times. This was a real theme coming out of the engagement exercise. People are concerned about variation in services across Humber and North Yorkshire, a little bit like the NHS app I spoke about earlier. There are, and we're trying to standardise this as much as we possibly can across the geography, but there are nuances across our 6 different places, which is something we're working on. Long waiting times for tests and treatment. Understanding and navigating the NHS. I mean, it's we always say in the team it's difficult sometimes for us to navigate it, and we work in the NHS, so can completely understand where people are coming from in terms of living in our communities. People want simplified public facing information, so that's a really important bit of insight that we've taken on as a team. We often think it's simple, but is it as simple as it needs? Is it even more simple as it needs to be for people to really understand and signpost them to the right place at the right time? And a need for different service models. So people want more one-stop clinics, more GP out of our services, and all services available 7 days a week. The person-centered approach theme that came out, this was largely around communication, coordination and integration, and the number one priority for people with a learning disability. People simply want improved communication and to have care being centered around a person's needs and that they are listened to. We'll probably go into more detail on this in a little bit. This, again, in the conversations I had again and again and again, and we've heard this for a while, the system's really complex, and people tell us that they're in the system and they feel like, whether it's mental health, whether it's primary care, whether it's secondary care, there seems to be a lack of communication between partners. And as I say, that one comes up time and time again. Integration and collaboration between services. People feel there is a lack of communication, and that's pretty much what I just said. This creates significant frustration for people and having to repeat their story. Self-care. People want the NHS to foster a greater culture of self-care and to support people to wait well, linking into that prevention stuff I mentioned a minute ago. Into staff and workforce, this wasn't just staff talking about this. This was, again, members of the public as well. There are real concerns about staff morale and quality of care. People believe the NHS is understaffed and that staff are under-supported. We've seen some national headlines around that one recently as well. I think it was last week. This leads to concerns about morale and quality and continuity of care, and people think NHS staff should be better recognised and valued. And linked to that, recruitment and retention, which is obviously really, really important and a huge challenge for not just us locally, but across the country. People think there needs to be a focus on how the NHS retains more of its workforce and recruits new staff to fill existing vacancies. People feel this is critical for frontline staff, especially including nurses and GPs. Other themes to come out, so productivity and efficiency. People want us to reduce bureaucracy and management costs. Definitely agree with that one. Address inefficiencies and duplication and review the allocation of funding resources. Future service provision. This was an interesting one. Over a quarter of respondents told us that there should be no reduction in the services the local NHS delivers. But the remaining 70% thought some services could be stopped or delivered in a different way. And 34% of those related to specific planned care services, which people felt were related to personal choice, things like gender affirming care, cosmetic procedures, fertility and IVF. People often told us that the NHS needs to change how it deals with preventable conditions, which they think have been influenced by lifestyle choices, in particular conditions which are related to diet, alcohol consumption and smoking. we've got 3 big campaigns coming up later in the year around alcohol, smoking and vaping, I believe it is, and really getting people to understand the dangers of all of that and how it can help your it's just the longevity of your life moving forward if you make the right choices throughout life, really. So a lot, as I say, linking to what I said earlier, a lot more people starting to think about looking after themselves a little bit more, or urging other people to look after themselves a little bit more. This was an interesting one and a bit of a surprise. Propensity to travel. The general expectation is that routine healthcare services like primary care and pharmacies should be nearby and within walking distance or accessible on a digital platform, while more complex or specialised care is understood to require longer travel times due to the specialised nature or location of these services. The inability to afford transportation to an appointment was regarded as either the least or second least important issue to address, and that was across all 6 geographical areas in the patch. Again, people just starting to talk about, actually understand that to get for the big ticket items, to see this, to get the best health outcome for something really serious, whether it's a heart problem, whatever it may be, seeing a specialist that may be further away, but the right person to see you, a bit more of an understanding that that might be the way to move forward more. So thanks, Bridget. So the vast majority of people want easy access to general health services, as you'd expect, in a coordinated way, as close to home as possible, or digitally. Over half of respondents expect to have access to urgent and emergency care within a short journey. And people reference improving primary care, out of hospital support with social care, better use of community spaces, and addressing health inequalities and community health as key priorities. I think I've gone over most of those there, Bridget, around analog to digital in the first infographic. Let's have a look. So, yeah, so this, thank you. So sickness to prevention, is a few more headlines to come out of this from the first slide that I went over. I've talked about the 16%. But over half of the people we heard from are already taking action to improve their physical health and mental health, which is a good thing. It also leaves a lot of people that aren't. And they're using a variety of measures, including stopping smoking, losing weight, and accessing mental health support. Most commonly, people said they're improving their health by living an active lifestyle and taking part in exercise. But only 14% of respondents told us that they felt they're already doing everything they can to improve their overall health and well-being. The top 3 barriers identified by respondents as hindrances to making positive changes for their overall health and well-being were motivations and willpower, time constraints, and habitual behaviours. And the time constraints was interesting because a lot of that came from NHS staff, actually, which is something we're obviously looking at internally across the system. Over a third of people told us that an existing medical condition, in most cases a long-term condition, is also a barrier which limits their abilities to take positive steps to improve their overall well-being. So the focus groups I mentioned earlier, we went to a number of key groups really across the patch as well. It's a really good spread across the patch, across all 6 geographical areas. And some of the key issues, the kind of key lines to come out of each of these groups, I'll just go through as quickly as I can. But so people with a mental health condition generally spoke about a lack of communication, integration between services, and NHS services not providing long-term support as the VCSE does. Groups with a learning disability, the main theme was they, and this was quite a hard-hitting one, and I think we see this in a video in a minute, they're not always treated with dignity and respect. They're not listened to and often talked over by health professionals. Veterans, a need for mental health support to be tailored to individual needs. I can remember one quote that said, not one size fits all, because that just doesn't work with mental health. That came out time and time again with veterans. The deaf and hard of hearing, the main theme was accessibility of services and communication, making reasonable adjustments. Again, in the video, you'll see, I won't spoil the surprise, because Bridget obtained a really strong story in her engagement work when she was out and about, and that's reflected in a video shortly, and quite alarming as well, as you'll see. LGBT plus groups, referral times for mental health and gender affirming care, concerns about wait times for physio, mobility issues affecting their mental health was the main theme there. Next slide, please, Bridget. Long-term conditions, groups with long-term conditions being passed around and having to repeat the story. Again, came up time and time again. In BAME groups, navigating the NHS was complex, and waiting times. Many people, especially I believe in Eastern European communities, returning home to their home country for treatment. A big example of that, of people I spoke to, were Eastern European communities for dental care, because they actually found it quicker to book flights, go home, get the treatment they needed, and then come back, even though it was at a cost and time to them. That was, in their eyes, the best decision for them to make for their health. Parents and carers, dental coming up again, and for those with children on a waiting list, the sense of helplessness which can lead to stress and anxiety. Women's health, experiences and instincts being dismissed and put down to common issues such as menopause, and not sometimes health professionals taking on board that maybe that individual knows their body better than anyone, which was interesting. And young people, as I alluded to earlier, mental health needs to be properly prioritised, and for issues to be taken seriously. Sometimes they think that older people just say lines like, I can remember someone telling me this, things like "man up," when actually they could really be suffering with something quite severe with their mental health. So we spoke to a group of young people from across the patch when we were up in York. These are just a lovely group, really. It was a wider group than just these 5 people you see on your screen, but they're part of the Nothing About Us Without Us group that we share a lot of our engagement work with, really, as we obviously look to build the NHS of the future. And here's what they had to say about our NHS. We were joined in York by Lulu, Amy, Ryan, Christina and Chris to talk about their thoughts on the NHS.
Yes.
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 I think the free prescriptions for young people and students are very good.
Well, free healthcare, yeah.
Free healthcare, and obviously the free prescription for young people, and also the people over the age of 60.
I'd say like the management of long-term conditions, like yearly reviews for things like asthma or mental health.
I think the NHS is fantastic when it works. I think sometimes when you're in the hardest or the toughest times, if you've got the most serious of issues, then it works absolutely fantastically. But for those people in between, and people not really understanding what all the stuff is out there, or how to access support or medication that might not be deemed in that 1% of really like serious conditions, that's where the NHS then falls down. But in that top 1%, if you are lucky enough to get that support, then it's fantastic.
I think there needs to be improved communication between like GPs and like the hospital, because I think there's a lot of disconnect, and it makes patients have to keep on repeating themselves, or it just makes it really difficult for both the patient and the doctor there.
More like understanding of like how someone is feeling, about the current condition that they're in, such as like the mental health side of it. If they've got a long-term condition that has gone undiagnosed, like that can affect negatively on the mental health because they don't have an answer. So like better communication when it comes to stuff like that.
I think like communication, like what Lulu said about like if your GP needs to like talk to someone in the hospital, have better communication, and also waiting times, even to get a GP. It's really hard to get a GP. My local doctor, you have to go at 8 o'clock in the morning and queue, because when you try and phone up, they just don't answer the phone. And it's hard for someone like me who works and my family works, so if I do need to go to doctors, it's either a walk-in centre if it gets that bad, or I just don't go.
I would say like accessibility to things like prescriptions or GP appointments for like the elderly or the vulnerable that can't necessarily like use the internet and things like that.
I think sometimes it's the consistency of the messaging. What you sometimes hear from a GP is very different to sometimes what you hear from somebody in the hospital, sometimes different to somebody who works for, say, CAMT. And I think that's probably due to a bit of a knowledge gap between each of them and the priority of different, whether it be primary care or whether it be urgent care or whatever it is. So I think without having a consistent message across whoever it is that you access support, then people who, particularly when it comes to mental health, people get confused and and then give up trying to get support, which then in turn makes things worse. And so we focus on physical conditions more so, I think, because probably some people see them as more urgent, but when it comes to actually across the board, we need to have that messaging that something like mental health can be just as urgent, but have that same understanding of what's available to that person in that time of need.
We were joined in York by Lulu. As part of the We Need to Talk campaign, engagement professionals embarked upon many face-to-face and in-depth conversations with people from our underrepresented communities. Here is a snapshot of some powerful stories.
We were able to reach many different communities across the ICB geography, and we particularly wanted to reach the seldom heard groups. And one of these groups we had the great pleasure to be invited to was the Deaf Club in Scarborough. The majority of the group members were profoundly deaf, and their first language was British Sign Language. And this is an active group which meets regularly and is supported by North Yorkshire Council. One notable experience that was shared involved a hard of hearing patient attending an audiology appointment at Scarborough Hospital. After checking in at reception, the patient took a seat as instructed and waited for their appointment. After a long wait, they asked why there was such a delay. To their surprise, they were told they'd already been called, but they'd not heard due to their hearing impairment. The patient has suggested an easy way to improve this is if the clinic used notification boards to display patient names by way of communicating, and staff are more considerate of disabilities to improve the whole patient experience. We attended a York BAME group, and this was made up of a lot of Eastern European communities, female communities, and a key point that they raised to us was the difficulty in navigating the NHS. And as a result of them not knowing how to access the services, they were actually going back to their home country to access health and care services.
I spoke to a patient called Trevor. Trevor suffered from angina, and his key issue really in the NHS was that of communication. And this actually became a theme in further conversations with other patients during the 4-week exercise. Trevor's issue, as I say, he suffers from angina. He's in the system. He's been seen a couple of times now. He knows there's further treatment down the line, but it's been several months since he was communicated from anybody within the NHS, and also has an issue with different organisations talking to each other. Again, was a theme. The way he described it was being on the telephone waiting desperately for some football tickets or some concert tickets, and not actually having any idea where you are in that queue. You're desperate to get the treatment, you're desperate to get the tickets, but you've got no idea whether you're actually going to get hold of them or not. And then he said, but when it comes to your health, multiply that anxiety by 10.
One of the real values of going out into the community and talking to groups who we don't hear from very often is actually really understanding the barriers that they face. So, for example, We spoke to a group of men at a mental health group on an estate in Scunthorpe. The men told me that generally they don't ring the GP practice because they're going to have somebody, as they described it, gatekeeping or trying to keep them from getting an appointment. What they didn't understand was anything around care navigation or the fact that somebody's trying to point them towards alternative health professionals who could deal with their problem a lot more quickly than having to see a GP first. Once this was explained, they were like, oh, actually, that's okay, we might try that. Now, we did explain that we do a lot of communications and we do a lot of promotion of these posts. But the thing is, these gentlemen didn't really access anything digitally, so they hadn't seen our communications. So that highlighted a clear need to actually do some face-to-face comms or face-to-face interventions around accessing healthcare. Now, a lot of people express that they have quite a fear of using the telephone, especially fear of being asked lots of questions they may not feel confident to answer. So basically, it's a lot more accessible for people to wait for their symptoms to get worse and go along to A&E. So again, I think what this insight shows us, well, it's twofold. One, that our services can't really be homogenous or can't be accessed homogeneously because a lot of people have very, very different barriers when it comes to either using a phone or accessing appointments through other means. And also, secondly, that there's a lot of work we can do around communications and around supporting people with information, advice and guidance that use non-digital means.
So I attended some groups in Northern Lincolnshire, learning disability support groups, and they were some of my favourite groups that I attended. People there were so friendly, they were really kind, they were really bubbly, they were so happy for us to be there. But I felt really sad about how those people were struggling to access health and care in our area. So I heard lots of different stories around people going to any clinician, whether it be a GP or whether it was in a hospital, talking about how people didn't have any knowledge or understanding of their conditions. And there was one lady who shared a story of going to the hospital, and she was talking around having a rhythmic spasm, and there was 10 clinicians around her who didn't understand what that was. And despite the fact the lady was explaining herself that she has a rhythmic spasm, and that if they were to call somebody up in Grimsby Hospital who normally dealt with her care, they would be able to explain what treatment she needed, but they didn't listen to her. And I felt really sad that that was a theme running right the way through both sessions in Grimsby and in Scunthorpe around people not listening and people not having knowledge of how to care for those people. They also said that often they would talk to a carer, to the carer instead of directly to them. And one man said to us that he felt like people would talk to him like a piece of crap on the floor, which is obviously heartbreaking to hear that somebody's having that experience. We should all be treated with empathy and kindness.
Thanks for playing those, Bridget. I put the link in the chat, so you've got access. It's on the website anyway. You've got access now to about 140 pages of the full report and about 120 pages of huge amounts of a data pack with everything in. So for those who love stats, that you've got all the detail there to look at whenever you want. We were just, I'm aware I'm already well over time, so just going to open up to any sort of comments really on those themes. Any questions at all really, but so all this has now gone to our board, which is obviously really important, the decision makers, if you like, and it's also gone to leaders from across the system. So all the leaders from around the system, the providers, the hospitals, the mental health providers, the ICB, local authorities, they all sit around the same table making decisions. It's gone to them as well. Decisions will now be made around things that we can take from this and change for the better straight away. Some areas we might need to look at formal consultation, potentially later in the year or next year. So it's very much in their court at the moment, and now feeding back to the public, exactly like we have done there, just to sort of close that loop. and let you know where we're at. So happy to take sort of 5 minutes or so of any comments, anything really.
Sorry, Mark. Can I come in with a question? It's Siobhan
Cool.
from
Yeah,
First.
yeah, sure, Siobhan, yeah.
So one of the national shifts that you mentioned was the sickness to prevention, and you spoke about how half of the respondents are already taking action to improve their health and well-being, which is obviously fab. We want prevention, don't we? But does everybody know what the full range is? You know, it's good, like we give up smoking and we can do this, but do people realize, you know, like if, for instance, listen, just I don't know, if you do some sort of weightlifting, it's good for us in later life who might be hit with osteoporosis. You know, is there sort of things that we can still educate us and ourselves about that we're not aware? You know, we know that don't smoke, don't drink, don't eat too much sugar, but the other things that are in the background that I think unless you're in a condition or you're preconditioned, you won't know about them. Is there a bit of work that can be done around there? It wouldn't cost a lot of money. Again, it's just about engaging, you know, and getting campaigns out there. Like I did a report years ago about different ethnicities and about different, you know, cardiovascular, different ethnic breakdowns and sickle cell, you know, different things, but there's a common factor. Cardiovascular will affect you, but in a different way dependent on your ethnicity. And if you do this, you drop the risk of diabetes, or glaucoma is high in Caribbean, you know, West Indian. So it's just about, is there something more that we can do in our communities to educate?
To answer your question quickly, yes. So it was a mixed bag in terms of some people saying, you know, like you say, nearly 50, I think it was nearly 50% said they were doing something, but actually when you explored it a bit further, they were, but actually there's probably more they could do, or there's a better understanding they could have. Certainly a bit like you say with the different communities, you know, like an example I always use is that type 2 diabetes is huge in the South Asian community. We need to do a lot on that as from a social marketing and comms perspective. We had a team meeting earlier, Bridget and I and others, around our budget going into the new financial year. Please give us some budget, and the things we can really do in our communities in terms of just educating people a bit more on exactly as you say, actually the benefits of weightlifting might be more tailored to a certain community where you tend to get a theme of a certain health condition. As an example, I'm actually a personal trainer as one of my side hustles, so I enjoy this kind of conversation. But it's, yeah, there's absolutely more we can do in terms of tailoring prevention messages to certain communities, without a doubt. I've got Jenny next. Hi, Jenny. I think you might be on mute.
One thing I thought I'd mention is the bad signage for some of these new community centres.
Yeah.
I went to Crossgates with my husband this morning, and there's nothing, even if you're outside the building, to say that it is Crossgates near Scarborough. And I went to another one that's near York College, and again, there was only a teeny little sign when you managed to find it, and there was no indication that it was behind Tesco's. And I mean, it just seems silly if they're introducing these new centres, not to give people a better idea of where they are.
Are these
decent signage?
The diagnostic units.
Diagnostic centre, yeah. You're not the first person to say that. At least two people said that to me, and that we need to talk stuff when I was out and about in community. So yeah, I think conversations have already started about that. So that is I wouldn't say it's a theme, because but I did hear it twice in conversations in the exercise we did before Christmas. So as I say, not the first person to say that, which is interesting. But you would certainly want the signage to be. I'm closest to the one being put together in Scunthorpe. I've not had a look round, but that's interesting. Thank you.
Yeah, thank you.
Yvonne? Hi. I just got a couple of observations rather than questions, really. In terms of the lifestyle choices, the smoking, drinking, etc., a lot of those habits are associated or linked with poor mental health. So if there was more investment into the mental health services and people could access them a lot more readily and easily, then that would probably help for them to change some of their behaviours. So I think it's quite hard to ask people to change lifestyle behaviours when they've got much bigger mental health issues going on that they're trying to deal with. So that was one observation. So I just, the point there, I think, is that if you're going to invest in helping people make the better lifestyle choices, you first need to deal with some of the underlying issues with their mental health. And then the other thing I wanted to mention is, so I'm actually from the MS Society. So I'm sort of working with people with long-term neuro conditions. And I sort of wanted to talk about some of the BAME stats that you put up. So I think there's a lot of work that needs to do around communication, but I think there's a lot of work that needs to be done around cultural awareness and competency in the workforce, because some people from different ethnic backgrounds or you know, they have different ways of dealing with long-term illnesses or any illnesses for that matter, and it's not as easy for them to maybe follow the system in the same way that we do, that are not from those backgrounds. And I think there needs to be some investment within the workforce to sort of help staff sort of develop that sort of understanding and awareness. So we have done some work at the MS Society around cultural competency, and we have maybe about 18 months ago, we ran a webinar for NHS professionals around that subject. That's still available. If you wanted to look at it, I can send you a link.
Yeah, please.
And the last thing I wanted to say quickly was that in terms of some of the generic services, helping people make the right lifestyle choices, for example, the staff working in those areas need to have some level of understanding of long-term conditions, because again, you can't just say to somebody, well, if you start going to the gym 3 times a week, you might actually feel better, because they might have a long-term condition that is a barrier, but also it takes up so much of their time, or they might have chronic fatigue or whatever. And I just think there needs to be some level of understanding across the whole of the services, not just people in the specialist services that already will have that insight. But that was just some observations, really. But I look forward to reading the full report.
Yeah, and as always, any questions to come out of that or comments out of the full report, please get in touch with either myself or the engagement inbox that will be shared at the end. Engagement email. Just on a couple of those, the mental health stuff is massive, as you said, and we're really keen to not just put out a mental health campaign and tick a box, because I hate tick boxes, I've said a million times on this call previously, but really look at the insight and the data. And as you say, that mental health before anything else is really, really important, and it's a huge issue. Just at an event I was at the other day, and it's not all about children and young people, but I think the stat was 36% of people accessing mental health services in Humber and North Yorkshire are under the age of 18. Well, that is going to have a huge implication on health services later down the line in other areas as well, isn't it? So we're really keen to really think about a really, and it's difficult because there's different issues and different communities and different age groups, and we won't have lots of money because we never get lots of money, but working with partners to really and working closely with the mental health collaborative that's well established now in delivering a really, really good mental health campaign. I think it's really important. Just on the cultural differences again, really, and staff education, we did a big piece of engagement work. It's about a year ago now. We published it. It'll be on the website as well, around pride and access to services, in particularly across the LGBT plus community. Really interesting insight coming out of that around healthcare professionals not really understanding people from that cohort, that background. And we are now pushing for a bit of an education process, a course, whatever it might be, in terms of, it was mainly GPs as well, which was frustrating, in terms of just a bit more of an education around people from the LGBT plus background. So I totally agree with what you're saying in terms of there needs to be, I keep using the word education, I want a better word, but we need to work with staff on with cultural differences, without a doubt. I would agree with
And also, linking with your local voluntary sector organisations, because they can help a lot with the education and awareness.
Yeah, thank you.
Judith, would you like to come in?
Hi, I'm Judith Webster. After the first meeting of this, I did say to you, I sent an email about the title of the group, patient engagement, but the lady earlier in her talk was commenting on deaf people. But what about those people, older people with dementia, etc., and younger people with learning disabilities that have no voice? This should be reading patient and carer engagement, because it's only the carer you're going to get the voice from that certain category of people.
Yes. Yeah, so do you mean in terms of the engagement work we've done, Judith?
Yes, from the beginning, it just says patient, but it shouldn't, because a lot of patients of any age group don't have a voice. Who speaks for them? Who represents them? It's the carer. And it doesn't even mention it on the title of this meeting.
I think that's a good point. We do have a number of carers that are members of what will be community voices. So we can certainly add that if everyone else agrees. I'm happy to do that.
Okay, thank you very much. Thank you.
And just in our We Need to Talk exercise that we did last year, we spoke to a number of carers in you're right in terms of we can add it to this title, but we spoke to a number of carers in those groups in particular to get feedback on the NHS as well. So we do take that area really, really seriously.
Okay, thank you.
All right.
So we can appreciate the view once again.
Martin.
Thank you, Mark. I've got 2 points. The first is my perennial one. Yet again, you're emphasising electronic communication, putting stuff on the internet. How are people who are not capable of using the internet, don't want to use it, ever going to find out about this? I would have said to you use the local papers, but they don't exist anymore. They've all vanished. People don't buy the whole Daily Mail because it's got nothing of interest to them. It's my favourite moan, as you know me of old. I'll just raise it once again. There's not enough emphasis on how you contact the people who don't use the internet, who can't use a mobile phone. That's the first point. Second point I have is I was recently unlucky enough to be admitted to Hull Royal. While I was in Hull Royal, I was seen by the specialist, and as a result of seeing the specialist, he said that I needed to go and see 2 other specialisms in the hospital. Not immediately, but very quickly. One of them has now contacted me, and I've got an appointment to see them. But the other one sent me a Patients Know Best message the other day saying, "Oh, we assume you've now been treated. We're going to cross you off our list unless you come back to us." This is the silo mentality again, where they're not listening to their own colleagues in the hospital and treating patients as if they're not needing stuff that's been recommended by other specialists. It's just not good enough, and that needs to be tackled. Sorry, I've been having a moan today, but it really irritates me. Thanks, Mark. No
worries at all. I think your first point, as always, is a really good one. It destroys me about the Hull Daily Mail, because I used to work at the Hull Daily Mail, and I used to love it there. And I've seen that. I was looking at their circulation a couple of weeks ago, actually, and it's absolutely plummeted, as you say. We are still feeding. There are still some people that read the local newspapers. When you look at the figures, not a huge amount, as you say. So we are doing that. We're also going back into the communities. So as part of that engagement work, when we're going into the community groups, when we're going to mosques, when we're going to Gurdwaras, when we're going to people with long-term health conditions, wherever it is, we're going back in and we're talking to those people. And a lot of those people tell me, or Bridget, or whoever's going out, they're not using the internet. So we're having that face-to-face conversation and building those relationships and maintaining them. And I'm really passionate about that, because as much as obviously there are some benefits of digital health, whatever it might be, we need to absolutely cater for the people that don't want to use it. And just on that, we'll go into this in a bit more detail in a minute around launching community voices in our online newsletter, but there will also be, we had this, don't shake your head just yet, Martin. we had a discussion about this a few days ago, and what we will be doing as part of that is having hard copies for the people that say they don't want to, they can't access things online. So, and in a world where, if I'm honest, everyone is trying to put things 100% digital, we've got a team that are really passionate about getting it right for everyone if we possibly can. So there is money in the budget for, look, the majority of people will receive it on an email, they'll want it on an email, but there will be no doubt a number of people that will want this through the letterbox, and that's what we're prepared to do. And it's really important that we look after those people as well. I know Bridget is particularly passionate around this sort of stuff and making sure everyone has the same access. So yeah, just to stress that point, and we'll go into community voices in a minute, I think, but it's just an example of our work where we will absolutely be doing hard copies of things, because I hear all the time people don't read leaflets anymore, but as in everybody doesn't, but some people do. And although it's a minority, you need to, as I say, you need to be catering for those people as well. So leaflets, whether it's through newspapers, although the circulation is dwindling compared to what it used to, hard copies of newsletters. In my last job in the NHS, we did an online newsletter, and I think we were delivering something like 80 hard copies of the newsletter every 3 months for the people who wanted it, and it wasn't a problem whatsoever. So we'll do the same here. Just in terms, there's some questions in the chat, Bridget. I'm just slightly nervous of time, and we've got a few more. Do you want me to collate those and then respond to those?
Yeah.
After, is that in email form? Is that okay?
We'll make sure if there's any questions in the chat, if we don't get time to go back to them this evening, they will be answered in the final notes that's shared with you all. So please don't worry about that. We'll get them answered.
Thanks, Bridget. Right, community voices. So this kind of links to what I alluded to at the start around the restructure. This is something we have been desperate to launch for a long time. We've kind of done this kind of a soft launch previously, and then we went into another restructure, and it kind of lost its momentum. But this is, can we have the next slide, please, Bridget? Is that right? This is our ICB public membership scheme. I know I've spoken about this before. Just a reminder there of the different levels we want to apply to it. Level 1, members will receive regular news bulletins, as I've just spoken about, whether that's hard copy or online. The local news to you will be at the top of that news bulletin. We're looking to this every 2 months from the start of April, by the way, because obviously people have told us that if you live in North Yorks, then you're more likely to read news, that's health news that's going on in North Yorks, as is if you live in Grimsby, you probably want to see the top few stories from Grimsby. So those first 2 or 3 stories in each of these will be place with the capital P specific. And then you'll have general news, ICB news, health news, opportunities to get involved, and system-wide stories as well, just to keep you as informed as possible, really. I'm really passionate about this. I must have told this story before. The more informed your population is, the richer their insight. So it's a little bit like someone talking about a service. If they've had an experience of that service, it's probably more insightful than someone who hasn't had an experience of that service. And it's the same with this. So the idea of the newsletters is that we're creating a more informed population. I talk about my dad whenever I go down there for a roast dinner, which is down south, which is rare, probably every couple of months. And we'll sit around the table and he'll start to talk about the NHS and give his opinion on the NHS. He's totally entitled to that opinion. It's not entirely informed. So what we're trying to do is make people as informed as they possibly can, transparent news coming out every couple of months and opportunities to get involved. And as a result of that, the better the insight we get when we put surveys out. Level 2 is this, just a kind of a bit of a step up, really, the opportunity to watch presentations, obviously the Patient Engagement Network. And again, it's looking positive, fingers crossed, in terms of budget for next financial year. As we've promised, we will be putting in that that face-to-face patient engagement network as well, at a central location, as it's difficult with the size of the geography, but we'll be looking to put that, I think, in the summer, if I'm right, Bridget, an opportunity to meet some of our ICB leaders, listen to presentations in person, a bit of a celebration of participation, a bit of food on, the opportunity to ask questions as well, a bit like you've got it here on a virtual level. And then level 3 is something we've kind of started, again, a bit of a soft launch already, but members who really want to be more heavily involved in everything we do as an ICB and as an ICS. You know, you could be a scrutiny panel, you could be a specific focus group on something. We might want to share some of our engagement work with you to make sure, actually, before we publish it or take it to our leaders, our decision makers, that we've engaged with everyone we possibly could. We had a meeting just before Christmas with about 10 to 12 really good people who wanted to give their input to our website. And Sarah, our digital marketing manager, has gone away as a result of that meeting on, I think it was on December the 6th, and has improved elements of the website as a result of, I think you were on there, Martin, and other people as well, in terms of inputting their thoughts into where we want to take our website. So that's just a reminder of the 3 levels. And I've spoken about this for months and months and months. And I know Trevor Brooks is one example over in North East Links, and he keeps saying to me, where is it? Where is it? Where's our first newsletter? So now we've got through the latest restructure, hopefully the final restructure. We've made some real good progress in terms of a new data system has been developed called Engage. So everyone who wants to join will register for it. And then obviously we need a database to hold everyone's information. And then we can put newsletters out from there and surveys and things like that. I can't even tell you how difficult it is to sort the governance arrangements for this and getting things signed off. DPIAs, I can't remember what it stands for, but that's what it's called. We've managed to get it through the governance team, and we can now kick on from the start of April, which is really, really good. All existing members will be contacted and encouraged to sign up to Community Voices. So if you've previously been a member of Accord in North East Links, or Embrace in North Lincolnshire, or The Loop in North Yorks, or whatever it is, you will get the opportunity to re-register. For data protection reasons, we need to re-register, which will mean we'll lose some people from our overarching 2,400 membership that we've inherited from the CCGs. But we can really press ahead with people that want to be engaged with. So it will be a really true reflection of the number of people that want to engage, and we'll grow that over time. And as I said, we're looking to launch that from April 25 onwards, and new newsletters will be coming out soon, and hard copy and virtual as well.
I've just seen a comment from Sue asking if the newsletters will be in GP practices. That's a really good suggestion, Sue, and that's something I'll just make a note of, because what could potentially be a really good ask is if we get any members of our patient participation groups from GP practices that register, you know, we can give them a supply of the hard copy newsletters, and that's maybe one way that we can work a bit more closely together as well.
That sounds good. Sorry, my camera's not working. I'm not being deliberately disappearing.
No problem. Thank you for that comment.
I think the idea of sending them via the PPG is a good one.
Thank you.
Albert, did you want to come in?
Yeah, it's yes. That's a good. I've got this problem when you turn it on. It's locked my camera. I can't move to do it. It was working when I came on, but when you put me in, it went off. The mic I couldn't turn off. That's why you're getting an echo.
I can't hear you great, Albert.
You try again, Albert.
Yeah, did you?
Can you hear me now?
Yes, yeah.
That's a bit better.
When you brought me in, it locked my camera. It was on, but it turned it off. It locked my mic, so I couldn't turn it off. That's why you're getting an echo. But then you muted me, and because I couldn't talk to you anyway. It's just one of them things. I don't know what happened.
If you've got any questions, Albert, if you'd like to put them in the chat, if that's any help. Right, I'm just.
No, the camera's not working. It's because I'm locked onto the meeting.
Right, I think it's because we've got you in twice, Albert. That's why we've got the echo. We've got you in two. You've signed in twice.
Did I?
I've got two Albert Bennetts, unless.
I've got a split personality.
Right, I'm just going to, if you've got any questions, Albert, if you want to put them in the chat, or please just drop us an email afterwards, and we'll get back to you as soon as possible. I'm just sorry you're having problems. So
all I want you to do is mention the new pub at Grimsby that's been. There's a big problem for the disabled. There's no parking area. No parking area at all.
No parking at Grimsby?
No, the thing is, there's multi-storey, but they have to pay for it. There's no free. There's a little side road, but you can't use that until after 10 o'clock to allow people unloading up. I know, because I just got a disabled badge, and to get down there, it's murder. Even now.
Albert, you've got my email address, haven't you?
What?
You're Albert from Grimsby, aren't you?
Yeah.
As you just said, I remember you from when I came over to the Accord Steering Group. Do you want to just drop me an email with all that detail? I couldn't hear it very well. I know it's about parking, but if you could drop that to me and I'll sort it out. I'll take it to the people that need to know about it.
Yeah. I spoke to quite a few people in there, disabled, and they've all said the same thing.
Drop me an email with all the detail on, mate, and I'll get it to where it needs to be.
Okay, will do.
Thank you.
All right, thanks, Albert.
Thanks, Albert.
Bye.
Hi, everyone. My name's Bridget Reid, and I'm the Insight and Engagement Manager within the Directorate. And I just want to run through a few slides with you. And the one in particular, the NHS 111 campaign. It's a recent campaign, and I just want to give you some background into it and just kind of give you some insight as far as how it was developed and why it was developed. Oh, my computer's gone stuck. There we go. So I'm sure you will all be aware during December, as a healthcare system across Humber and North Yorkshire, we saw a rise in pressure, and we had a surge of cases of the norovirus, flu, COVID and respiratory conditions, which was dubbed the quandemic, and this was putting hospitals, GP practices under significant strain. So this literally is the reason why we actually brought this campaign together, and what we focused on was a targeted NHS 111 campaign to support our system during the time of immense pressure and highlight the convenience and the benefits of using NHS 111 to people, raising the awareness, people having that immediate action to healthcare advice, and equally signposting people to the appropriate services as well. So the actual campaign itself was driven by data and insight, and as Mark alluded to earlier, this is very much as far as our focus going forward, is that our campaigns are going to be built around what we already know and what the data and the insight is actually telling us. So this campaign, we were able to identify to the actual GP practices where there was the highest emergency department attendances. But this was actually specifically focusing on the patients that were leaving the hospital without significant treatment and also with no investigation. So not just the highest ED attendances, but also where we could see we had the lowest usage of NHS 111, so where people weren't using it. And the three areas across our ICB were Humber, North Lincolnshire and North East Lincolnshire. And then the GP practices, which are detailed on the slide: Good Heart Surgery, Orchard 2000 in Hull, Trentview, Riverside in Scunthorpe and Brigg, and Stirling Medical Centre and Birkwood Medical Practice in Grimsby. And the age range that this category focused on was actually between the ages of 35 and 64. So what we were able to do, we'd got the insight, we knew our audience. So our great social media team that we have, they developed a targeted paid social media campaign. And this was directed to the 6 hotspots areas that I've highlighted earlier. We had already gathered some positive patient experiences on people that had used NHS 111, and this was a great opportunity to build the campaign by giving people actually real life experiences on how they had used NHS 111 and the help and assistance that they'd been given, just really to again emphasise, raise the awareness of how this service is able to help people. With regards to GP practices, the team put together a communication toolkit, and this again was information to help the GP practices, where it gave them supporting messages that they could put out in text messages, they could include in their newsletters. There was materials that could be put on their TV screens in practice waiting rooms, social media, and this was all a package that was to help and assist the pressures on all our system. Now, the early interventions, the early evaluation, showing thousands of visitors to our Let's Get Better website. Now, that's our public-facing website, and this is what you will be seeing a lot in our campaigns, and that's what we are driving forward as our branding on the Let's Get Better, and we'll be matching a lot of our campaigns throughout this. And we've had over 9,500 views on our social videos that we've put out there. We've recently, in early January, we've actually started putting TikTok videos out, which has been a great success. And maybe at a future meeting, we'll actually bring in some of our social media and marketing colleagues just to share with you what they've actually been doing and some of the messages that they've been shared. So as well as the toolkit, the social media, we focused also on those areas. And we did we're continuing to do some mini outreach sessions. And this includes going into community venues, places where there's high footfall. As Mark mentioned earlier, we visited North Point Shopping Centre last Tuesday. We handed out NHS 111 leaflets to members of the community, and we did gain some great insight as well. And what was welcoming was the majority of the people were well aware of NHS 111, and people had actually used the service. So it's just, again, continuing to get those messages out to help the overall system. This is just an example of some, and many of you may have seen some of the social media that's been put out there, but this is just some of the messages, and you will get these slides, so you will be able to see them in more detail. But I just wanted to show you and give you an example of some of the messages that's actually been put out there. This is a video also that I'd just like to click on and show you, and this is just an example of how we're trying to be a little bit more creative in getting some of those messages out there, but using real life patients' experiences. So bear with me.
I'm Nick. I'm a dad living in North Lincolnshire. NHS 111 is a really useful service, especially with a young family like ours. They can be fine all day, and then it gets to 7 p.m. and they show some terrifying symptom. And 111 is the first port of call when something like that happens. We've used it from both extremes for advice when they're a bit poorly, to having had the doctor send us an ambulance. When our baby was quite little, she was a bit poorly. We were keeping an eye on her, and then at 10 p.m, as it always is, she started getting a rash that wouldn't go down. So we rang for advice and sort of reassurance. And we were given that reassurance when we were then called back by a doctor, who then said that we need an ambulance, which was a bit scary, but we knew we were getting the service that we needed and the support that we needed. She got put on a ward and she's all fine. I'm really glad that we rang 111 and that was available, because without that, we wouldn't know what to do at 10 o'clock on an evening. If I was giving advice to anyone who'd not used 111, or from my point of view, someone with a similar small family, I would say definitely use this service. If ever you feel like you need it, if ever you're worried about something or someone in the family, whatever illness or injury, they'll take you seriously, they'll listen, and they point you in the right direction, and it's ideal. Hello?
Can I please have a snack?
Yes.
Yeah, of course you can.
And as I say, you will get the slides so you can have another look at these in your own time.
I'm Nick.
So just very briefly, kind of giving you the next steps and moving forward, you know, NHS 111 will feature in our seasonal targeted campaigns. This is going to be very much a focus as we move forward. And as we've just started, we're starting to look at the insight, and particularly, you know, we've got Easter holidays coming up, and we know in our in the area we do have an impact of tourists, and that also has an impact on our health and care system. So we are planning to look at the insight around the impact of tourism on the services, just to understand where the tourists are travelling from, you know, what can we do to make people best prepared before they actually come into the area, make them aware of NHS 111 before they actually go on holiday. And this will include a lot of working with our colleagues outside of the ICB. We know a lot of people come from the West Yorkshire, people come from more northern Teesside, and it's reaching out to those localities, you know, so we can better prepare people and make them aware of the 111 service. And we are going to do a pilot on this tourism campaign in Scarborough and the surrounding area. And this is just an opportunity for us to really target and just to see, you know, how successful it is. So that's just, again, giving you another example of a campaign, and again will be based on insight and what the data is telling us. I'm just conscious of time, so you are getting these slides, but I'm just going to go through these maybe a little bit quicker than I would have normally done. But many of you on the call, if you were signed up to come to the November Patient Engagement Network meeting, a survey was shared in December. I mean, the whole purpose of our PEN meetings are to keep connected with you, to keep you informed of what's taking place in the ICB. And the PEN meetings have been first launched back in November 23, and feedback was sought at that point. And the feedback then was that you wanted more emphasis on two-way engagement, and you wanted the meetings to have more interaction. And we have listened, and as time has gone on, we have made those meetings more interactive, giving people that opportunity to get involved. And at the November meeting, we introduced the breakout sessions as well. So there is a report, a short report coming out with the presentation, and we'll share this with you tomorrow. But I just want to give you an overview. You know, the reason we did this is simply to continue to get your feedback, to understand how we're doing, how can we improve, how can we, you know, make these meetings better, and what are you wanting to hear from us. But at the November meeting, we actually had 69 members register to attend, acknowledging that people's circumstances do change. But what we particularly wanted to understand was that, was there anything preventing people from taking part in these events? The results are there. You will receive that information. We did understand from the feedback that there are some issues as far as technical issues, people maybe needing a little bit more assistance accessing MS Teams. We're here to help. We'll send instructions out with the notes. If there's anything more we can do, please advise. We did highlight an issue. Some people do have two email addresses. We do ask if you register with an email, you please do use that same email to sign in on. This just does cause us a bit of technical glitches. I won't run through this. You can see it in your own time, but I think it's just important to say, if you look at the blue column and the orange column, which is very satisfied, be it blue, and the orange is satisfied, that is telling us some positive information. People are wanting to attend future events, which is what we're wanting to hear. People are wanting, the events are what people are expecting to hear, and the information that we are sharing is helpful to people, you know, so there's always room for improvement, and, you know, we want to continue to do that and work with you to ensure we get there. What we did find, we had some positive comments. I won't go through each of these, but we had some positive comments following the November session, which was greatly appreciated, acknowledging that it was the first time we'd used the breakout sessions. So hence we did have some negative comments. We had technical issues. You know, every day is a school day, so we're always, you know, wanting to get better. Many want to see more breakout sessions, so, you know, we've got longer time designated to that as well, to have more conversation. People are wanting to see its breakout into more from our locality, so into each different places to have more of a dialogue. Future agenda items, we've got a full list here. We want these meetings to be about what you want to hear from, so we have got that information in front of us now. We have an understanding of what you want to hear, so we will work through these, and we will incorporate as many of the items as we can going forward. The ICB face-to-face meeting, preferred location. This is a very mixed bag. When members were surveyed back in November 23, people were prepared to travel up 20 to 20 miles. We know North Yorkshire, Humber, it's a huge area. We will do our utmost to get a central location, a preferred option that's coming out as York, but we will do our utmost, and we will obviously liaise with you before any final agreements are made. We will ensure there's disability access, and it is near a train station, so it's easy access for everybody. And I would like to thank everyone for sharing the feedback. We can't do these meetings without you. We want to ensure, you know, we're giving you information, the topics are what you want to hear about. We will consider the length of time of these meetings, so we give sufficient time if we do have breakout rooms. We spoke about the venue, and we'll keep members updated, and that's what tonight was very much about, was continuing that conversation. We informed you firsthand about We Need to Talk. Tonight is very much about sharing those outcomes with you, and that's what we intend to do with many of the groups that we actually went out to. We will be going back out to certain ones that particularly wanted us to go back to and share the feedback and the outcome of the report. Thank you. Sorry that was just short and sweet, but you will get all the information.
Thanks, Bridget. I just wanted to, we've only got a couple of minutes left, but if there were any questions or comments for Bridget on the NHS 111 stuff in particular, or the feedback survey. Judith.
Yeah, you've mentioned 111 pilot in Scarborough. It's horrendous. That is my local area where I could go to. There is a massive delay in the new A&E department because of certain things that are costing millions. It should have been open at the end of November because I'm a member of that trust. But also, what's really frustrated me, because I've been a governor of a mental health trust and involved nationally, you've not mentioned 111/2, option 2 for people with mental health issues within North Yorkshire. And it's a big problem, especially for older people and their carers. And you've not mentioned 111 option 2.
We have. I thank you for raising that, Judith. What we found when we went out in last year with regards the 111 service, we started the engagement raising the awareness, but also trying to get an understanding of what people knew the service could provide. People weren't aware that it could provide mental health services, but I didn't realise that we had to recognise it as 1112. When we are talking about 111, we always identify that it can, for urgent mental health, that is what we do say, but I wasn't describing it like 1112, and I didn't know that, so thank you for raising that with me.
Okay, there are a lot of issues with the Scarborough area. I can give you an example. They were asking a failed kidney transplant patient. The husband is 81, and they told him, because of the delay, well, can't you lift her and put her in a car? He's 81 with his own problems and was asking to lift. So they had to get a taxi to help them. There's massive issues in Scarborough. It's horrendous.
If you are aware of issues and concerns, Judith, I would advise that there's the slide on screen now for this feedback to be shared with our experience team. If you want to share this information with anyone that you are aware that's experiencing
Yeah, I will do, and
problems.
I'm willing to be spoken to about stuff, especially mental health and locally Scarborough. Very willing to speak to anybody about it.
No, that's greatly appreciated. Thank you. Are you connected with a patient partner group, a local group, Judith, at all?
About everything in North Yorkshire to do. Well, I'm a governor for CHUV, and I have been for 15 years and involved for 21 years. I've been involved nationally with dementia, David Cameron's talks and everything, and spoken internationally about what it's like to be a carer of people with dementia. I do know all the local, voluntary sectors around this area, work closely with them. And I'm a member of York Trust as well, because the chair of the York Trust used to be the CEO of our mental health trust a few years ago, so still close to both of them. So I'm willing to help if there's anything I can do locally in my area. I'm absolutely willing to help.
Thank you. Well, we've got your email, Judith, and I've got your name written down.
Sorry,
and
I might be
highlighted.
whinging. I'm not whinging. I'm just literally offering to help if I can do.
Absolutely fantastic, and we can't thank you enough. Thank you so much. Thank you.
You're welcome. Thank you.
Just so I was on mute there. Anything else at all from anyone for Bridget? I can see there's a couple of bits in the chat again. We will get answers to all of these in the next couple of days. Just the slide there, as Bridget's alluded to, around the patient experience, any general feedback, concerns, complaints, that kind of stuff. We just remind you every time that this is the place to go. This is all part. We now work really closely with the patient experience team, not just at the ICB but across the system, so sharing not only our public intelligence and insight reports from engagement work, but also looking at patient experience and bringing all that together on the into sort of one forum, so that we can learn a little bit quicker and a bit more efficiently. So just a reminder there of who to contact with any of your experiences in any NHS services. But is there another slide with our details on, Bridget, or have I just...
Oh. No, there is.
No, it's fine. As always, any feedback on today's meeting, please, and the things you've heard or seen, any further questions outside of the chat, please, you can email me direct, mark.williams21, because it's quite a common name, mark.williams21@nhs.net. In fact, it's easier if I put that in the chat, and I'll do that now.
Do you want to put the engagement email, Mark?
Yeah, I was trying to avoid that, Bridget, because I've completely forgot what it is, but I will put that in the chat as well.
Can you put that? Because I'm just thinking
restructures.
from to get a timely response, it might be better coming to the engagement inbox.
Well, that's very cheeky of you because you're implying that I'd be really slow. It might be a good idea. Yeah, I'll put that in as well once I know exactly once I can remember what it is. Next meeting, Bridget, what's the date on that slide?
It's Thursday, the 8th of May.
Thursday, the 8th of May.
Yeah.
Fantastic. Just wanted to say a massive thanks, as always, to everyone for attending. As Bridget said, without you, it's not possible. We're really, really keen to make this as informative as possible moving forward. I think we've had some good meetings in the past, and some of the feedback has reflected that, which is great. We're looking to get more people involved in terms of presenting, whether it's local GPs, decision makers, far more important people than me. But yeah, just looking to make it as interesting as we possibly can for you. Hopefully you're enjoying it. A bit of an experiment tonight in terms of the evening time. Give me some feedback on that as well. That'd be really interesting to hear whether it's worked better for you, not quite so well. And we'll make it as good as we possibly can for you. Thank you for attending.
Can I just say a final?
Sorry, Bridget. Yeah, of course you can.
So, just picking up on the community voices and the relaunch, can I just reinforce to you all that you will all need to re-register. I know Mark mentioned that, but I just want to echo that in order for us to form our May meeting, if you are still interested in continuing to be part of our community voices, we do ask that you are able to re-register when the email lands with you, because for data protection, we have to let our old lists go to form a new list. Thank you so much, and sorry for the inconvenience, but.
All right, take care all. Thank you.
Thank you very much.
Thank you. Bye.
Bye.